Today's topic is explained on this slide. So if you read this slide, you could leave right now if you don't want more detail, but I'd say stick around because there's plenty more detail to look at. Antidepressants massively raise the risk of sudden cardiac death. This is a statement that came out of the European Society of Cardiology in March 2025, as I'm about to show you. So basically, the longer you take antidepressants, the greater your risk of sudden cardiac death. And there is varying risk depending on your age and how long you've been taking them. So let's dive into those details. That study you can see is right here from the European Society of Cardiology, March 2025. This was presented at their conference. And so this is what it looks like if you go to their website, but we'll jump over to the PDF copy so we can dig into the details. Let's do that now. So here we are on the paper from the European Society of Cardiology, and the title is Use of Antidepressant Medication is Linked to Substantial Increase in Risk of Sudden Cardiac Death. So what is sudden cardiac death? Sudden cardiac death refers to an unexpected death of a person believed to be caused by a heart-related issue. It occurs within 1 hour of the onset of symptoms in witnessed cases or within 24 hours of the person being last seen alive in unwitnessed cases. So basically, it is what it sounds like. It's a surprise death attributed to some sort of heart issue, previously asymptomatic and unexpected. The causes in people under the age of 39 are often a thickening of the heart muscle or an electrical problem with the heart. In older people, it's more likely to be caused by a narrowing of blood vessels that supply the heart. Previous research has shown that patients with psychiatric disorders have an increased all-cause mortality, which means increased risk of death from any cause, as well as double the risk of sudden cardiac death across all age groups. However, the impact of antidepressant exposure on sudden cardiac risk has so far been unclear. So that's what this study sought to do, is to look at what contribution, if any, do antidepressant medications lend to sudden cardiac death. So in their research published this year, the Scientific Congress of the European Society of Cardiology shows that compared with the general population with no history of antidepressant use, individuals with a history of antidepressant use have increased risk of sudden cardiac death. Exposure time and age are the variables. So this paper looked at over 600,000 residents of Denmark between ages 18 and 90, 18 years old and 90 in the year 2010. And they looked at people, they had three groups. They had people who had never had antidepressant medications, and then they had people who had been on antidepressants from 1 to 5 years or 6+ years. So when they dug into the data, we can see that the group exposed to antidepressants for 1 to 5 years had a 56% higher risk of sudden cardiac death, while those exposed to antidepressants for 6 or more years experienced a 2.2 times higher risk, so 220% greater risk of sudden cardiac death if you're on antidepressants for 6 or more years. Now, if you break it down by age, they found that in individuals aged 30 to 39, compared to people who had never had antidepressant drugs, those with 1 to 5 years of antidepressants were 3 times more likely to suffer sudden cardiac death. And the risk increased to 5 times higher for those who had been on them for 6 years or longer. In the 50 to 59 age group, compared to people who had never had antidepressant meds, those taking antidepressants for 1 to 5 years had a double risk of sudden cardiac death, while those taking antidepressants for 6 or more years had 4 times the risk of sudden cardiac death. That's age 50 to 59. And so the trends were similar with each decade. And so, antidepressants are widely used in the United States. If we go to this paper from 2022, published in the British Medical Journal, this was a paper looking at over 230 randomized double-blind placebo-controlled trials that had been submitted to the U.S. Food and Drug Administration between 1979 and 2016. And this studied over 73,000 adults and child participants on antidepressants. And what they were doing was they were looking at what's the response to acute monotherapy. So, what's the response to antidepressants for major depressive disorder? And as we said, many people are on these medications, not just in the US, but worldwide. But this paper here was looking at US numbers. And we can see here in 2022, about 13% of Americans were on antidepressant medications. That's 13% of 330 million people. So over 30 million people. And that number had more than doubled between 2000 and 2015. So in 15 years, the number of people in developed countries on antidepressants had more than doubled. And the authors say, quote, although many factors affect depression and suicide rates, the hope was that wider use of antidepressants would improve these rates. Wah, wah. Nonetheless, these rates have generally increased, particularly in younger age groups. So we're pumping out medications to treat something or supposedly save lives from depression and suicide. But they say in the paper, the rates of those two things, depression and suicide, have increased, particularly in the younger. So more antidepressants are not the answer, especially when you look right here at the conclusion of the paper that says about 15% of participants have a substantial antidepressant effect beyond a placebo. So of the millions and millions of people taking antidepressants, only 15% get a benefit that can even be given or attributed to the drug beyond placebo. The rest is all placebo. So we are exposing people for years and years and years to antidepressant medications, and being on those medications for years is massively increasing the risk of sudden cardiac death. What? For the hope to reduce depression and suicide, which the research is showing isn't happening. So again, these medications appear to be 100% risk and near 0% benefit. And I've said this in other videos and shown other research that half or more people who take them get no benefit. Well, that's generous because this paper is saying about 85% of people get no benefit beyond placebo. So if you'd just given them a sugar pill, it would have the same benefit as taking the antidepressant, except the sugar pill doesn't have the side effect of sudden cardiac death. So if you're out there and you're struggling with depression and you've been on SSRI medications for years and they haven't improved your experience, then all that you're getting is potential sudden cardiac death, potential negatives, potential side effects. So you need to seek out professionals who can approach your issue from an angle other than SSRI medication. In the prevailing healthcare model in the United States, all they have is a hammer, and that hammer is called an SSRI medication for depression. So anyone with depression that walks into their office is a nail, and that nail gets hit with the same hammer by every doctor. Take this SSRI medication. But the research is saying that thing doesn't help, and it massively increases risk of death, especially the longer you take it. So seek out doctors that are looking at your issue from many other angles and can help you from many other angles, because there are many drivers of depression, and a deficiency of selective serotonin reuptake inhibiting medications is not one of those mechanisms. Lifestyle is a major driver, including nutrition, physical inactivity or overactivity, sleep deprivation, toxic exposure, high stress, whether it's a conscious stressor like relationships or finances or chemical, or whether it is an unconscious stressor like a water damaged building and mold exposure, or fluoride or heavy metals or things like that. So if you want to heal, you need to find the cause, and taking an antidepressant medication is not addressing the cause. So seek out a functional medicine practitioner in your area to help you get closer to the optimal life that you desire.
All right, my mom has been trying to get off of her Zoloft for a couple of years now, but she said she doesn't think that it does anything at all. But she has a lot of trouble trying to get off of it. She's tried a couple of times and without success.
Does she have the ZAPS or the serotonin syndrome type of symptoms?
She woke up in the middle of the night and felt like she couldn't breathe and had to go out of the house. It was almost like a massive panic attack, I guess. And she like had to walk around in her carport for like an hour before she could go back in the house.
Oh,
But it was just like right in the middle of the night, just woke up out of a dead sleep and just couldn't breathe at all. Yeah, she was trying to wean off, and I told her to cut the pills in half and just try to. So she doesn't take them every single day like they tell you to. And she'll stop and start sometimes. And they say that's not good for you to do that with those pills, but I don't really know what that does to you.
yeah. Well, when you're coming off, especially the longer you've been on them, you definitely, you don't really want to come off without working with the person who prescribed it to you because, there's the longer you're on them, there's the possibility that the body could adapt to them and need them. And so I've had patients that were on them long term, for example, and they tried to come off on their own and they experienced what they call the zaps, like they would feel like electric shocks. And one thing that I noticed over multiple patients that had explained that or experienced that was that they were low in essential fatty acids, especially DHA, so the more cognitive fish oil. And so if they dosed up the DHA, they were working with their prescriber, they were able to come off without the shocks, the zaps in those instances. So again, you want to work with your prescriber and let them know your desires and have them walk you down off of it because again, you could have receptor remodeling when you're on those medications for too long. It's kind of like um, if I paid your bills every month for 10 years and then after 10 years said, hey, I'm not going to pay your bills anymore, go work, it'd be hard for you to go work because you'd acclimated to the generosity or the, altruism. And so same idea, if we are replacing body physiology pharmaceutically and then we just pull it out, there's potential that the body's like, what the heck, man? I forgot how to do this, or I can't do this. And you can have symptoms that way.